Hi, my name is Arella, and this is my innovation project video proposal, signature assignment DNPU 702. I will be discussing problem the innovation will solve, background of the problem, innovative collaboration, utilization of appropriate technology, and innovative solutions. Elderly patients may experience dementia and show signs of confusion, loss of interest, loss of memories, and have difficulties with everyday tasks, which can lead to depression. One of the most influential forms of art is music and has been around since the beginning of time. Music offers a one-of-a-kind emotional journey that may be interpreted in many ways. There is some evidence that listening to music might improve social interaction and moods among people living with dementia by evoking positive feeling and bringing back fond memories of time spent with loved ones and friends. Problem the innovation will solve. The clinical problem is that elderly patients with dementia manifesting signs of depression will examine how music intervention compared to current standards of practice can decrease manifestations of depression. Depression can be experienced by individuals throughout their life, while dementia can occur later in life. There is a relationship between dementia and depression, and increasing data shows that the time period of an individual's depression can be significant in correlating the nature of the association. Individuals who experience symptoms of depression can early in life have twice the risk of dementia. Individuals who suffer from dementia often experience both psychological and behavioral symptoms that can lead to a poor quality of life. The most common psychiatric syndromes in the elderly are dementia and depression, and changes in the cognition are observed in patients with mood disorders and depression. Background of the problem. Dementia affects around 50 million people worldwide, and by the year 2050 it is projected to triple in number. Individuals with dementia may experience signs of memory and language loss, behavioral problems including depression, anxiety, and cognitive alterations. According to the CDC, 2023, in 2014 there were about 5 million individuals who were at least 65 years of age with dementia. By 2060, it was projected there will be nearly 14 million people who will be diagnosed with dementia. Adults who are older and have chronic illnesses have a higher risk of developing depression. Around 80% of adults who are 65 years and over have at least one chronic health condition, and about 50% have more than 2 chronic illnesses. People who also have other illnesses such as cancer or heart disease or have functional limitations may experience a higher incidence of depression. Individuals who are elderly can be misdiagnosed in practice or not treated at all. They often do not seek help from healthcare providers because they don't understand that their illness will improve with the correct management. In elderly individuals, major depression ranges are less than 1% to about 5% in a community, but it increases to 13% in individuals who need home health care and to 11% in patients who are in the hospital. More than 300 million older adults worldwide were experiencing depression, which is a prevalent medical condition worldwide. The table above shows the incidence of dementia and depression among dementia patients. There are about 300 million elderly individuals worldwide who suffer from depression. Depression that lasts for a long time and is severe may have health consequences that are negative to the individual. Background. The prevalence of depression with advancing age increases. In the study by you in older adults who reside in nursing homes, there are about 20% to 50% who experience depressive symptoms that are important clinically. In the past, other solutions such as keeping elderly in a facility too long could contribute to their depression, which could include pain and the length of stay for greater than 2 years in a facility in isolation, decrease in social contact, and earlier history of depression. Chronic illnesses, decrease in social contact, lack of inconsistent familial support, and sleep deprivation are risk factors found in the elderly that may trigger depression. The prevalence rate for depression was higher in people having longer stay in nursing homes or assisted living facilities as compared to those who lived with family or on their own. The solutions of keeping elderly patients at a facility without giving them activities and social support was unsuccessful because there would be less interaction and the elderly patients would show more signs of depression. The cost of health care is important to both patients, their families, and society. The most common cause of dementia is Alzheimer's disease. It is the 5th leading cause of death in the elderly individuals. The total health care cost is $305 billion for the treatment in 2020 for Alzheimer's disease, and as the individual gets older, the cost is expected to rise to more than $1 trillion in the future. The cost of Alzheimer's disease can be attributed to many factors, such as the use of home health care, hospice care, and skilled nursing facilities. Informal caregiving costs are indirect and may affect the quality of life of the individual. Developing strategies that would aid in a sooner diagnosis and treatment of dementia may lower the expenses for the elderly patients and provide them with a better outcome to their condition. Innovative collaboration. The 3 collaborators who I interviewed were the medical director of our clinic, the clinic manager, and our medical assistant. I explained the reason for the interview that I did, and I gave a brief description of the mobile app and how it would address and how it would help our patients with dementia. Seniors who are 65 and over comprise about 80% of our population in our family private practice. There are patients who have been diagnosed with dementia and depression. A mobile app that would help seniors in our office and community connect with the seniors and help the office become more innovative. The medical director, clinical manager, and medical assistant all agree that the mobile app staff would be helpful with patients who are elderly and suffering from dementia. When the mobile app was introduced and described, the medical director said that the staff app was amazing for seniors and could really be a game changer for people with dementia and their caregivers. The mindfulness activities are calming, and the patient with dementia and their caregivers would it would be useful to them. More importantly, this app is also for caregivers. The medical director was interested in how we can help caregivers with setting up the app. The caregivers or family members would have to use the app and connect with the providers and the primary care clinic, and will help guide the caregivers on giving care to our patients. The medical director asked about how the providers can have access to the staff app and how providers can communicate with the caregivers to answer their questions or concerns. The app will connect the caregivers to the moderators who can guide and provide advice to the caregivers. It provides links in the relevant websites for additional resources. The medical director can work with the medical providers and clinical manager to set up meetings regarding the staff app and enroll the providers to the new app as well as the other office staff. The medical director also asked about the cost of the app and if the providers would have to pay to use it. The app would need to be downloaded by the caregivers. Utilization of appropriate technology. A mobile app that would help seniors in our office and community connect with the seniors and help the office become more innovative. The mobile app in this study was an interactive mobile app called Stav, In the study, there were 2 nurses in the research team through a mobile app over an 8-week period that supported the caregivers and families. The mobile application is unique as it was developed by involving the stakeholders of family caregivers and healthcare professionals, and because it was interactive in nature. Family and caregivers were asked about the contents that they would like to have, such as in the mobile application. In the mobile app, suggested several functions which would facilitate support in addressing challenging caregiving situations. The mobile app Stav has the following features: chat, mindfulness, exercise, web links to relevant sites, own contact list, and a personal diary. This app is very helpful for the healthcare professionals. And they were asked which types of care needed to be addressed through a mobile application, or if it could facilitate communication with caregivers. Both the family caregivers and professionals, elderly individuals who need assistance in coordinating medical care. The app has several functions that would facilitate support in many areas for the patient suffering from dementia. Innovative solutions. My proposed solution is innovative because the use of mobile health apps are becoming more popular. They are a great tool to help caregivers and families come together and receive assistance from nurses and healthcare providers. The 3 people that I interviewed thought the Stav app was a great app and were willing to help the innovation with the caregivers and patients at the office. Technical information was given about the Stav app in our workplace. The social, ethical, and financial cost of the Stav app was discussed with the medical director and the clinical manager, and they all agreed that it was feasible, and they were willing to give it a try. The medical providers will be available for the patients on the Stav app and will answer questions from the caregiver and patients with dementia, if necessary, through the telehealth, doximity, or actual visits. Each person that was interviewed agreed that the Stav app would be beneficial to our patients and caregivers who have dementia, and each had their own perspective in how we can incorporate the innovation in our office. Through this app, a caregiver of the person with dementia can answer a survey, chat with moderators that can guide and provide advice to alleviate stress, get links to relevant websites, and access audio or videos for mindfulness. Conclusion. People who have Alzheimer's disease and related dementias often display disruptive behavior such as aggression, wandering, and restlessness, which increase family caregivers' burden of care. The convenience that smartphones bring in a daily life is tremendous. Users can access the health and related services anytime and anywhere with a click of a simple touch of a finger. Mobile health apps are becoming more and more influential in real life. They play an important role in health communication and for disease prevention. User impressions of apps designs are influential for adoption. Using cues to increase feeling of being with others, social presence, is one way to encourage favorable impressions and healthcare app adoption. Mobile health apps are becoming more popular because they are a great tool to help caregivers and families come together and receive assistance from nurses and healthcare providers. The 3 people that I interviewed through the Stav app said that the Stav app was great and was willing to help start the Stav innovation with the caregivers and patients at the office. Technical information was given about the Stav app in our workplace. The social, ethical, and financial costs of the Stav app was discussed with the medical director and clinical manager, and they all agreed that it was feasible and that they were willing to give it a try. The medical providers will be available for the patients on the Stav app and will answer questions from the caregiver and patients with dementia if necessary, through telehealth, doximity, or actual visits. Each person that was interviewed agreed that the Stav app would be beneficial to our patients and caregivers who have dementia, and each had their own perspective on how we can incorporate this new innovation to our office. Hi, here are the references. Thank you. Have a great day.